Hello guys, welcome to our channel Easy Drug. Today we learn a topic about antitubercular drugs. Before going to our topic, first we should know what is TB. TB is an infectious disease that is commonly caused by an organism known as Mycobacterium tuberculosis. Symptoms of TB: generally, a patient who are affected with TB, they had symptoms like weight loss, coughing up blood, cough, chest pain, breathing difficulty, and fever. Antitubercular drugs. It is classified into first line drugs and second line drugs. First line drugs, there are isoniazid, rifampicin, pyrazinamide, ethambutol, and streptomycin. Second line drugs, fluoroquinolones like ofloxacin, levofloxacin, moxifloxacin, ciprofloxacin. Then ethionamide, prothionamide, cycloserine, para-aminosalicylic acid, rifampicin. Injectable drugs, kanamycin, amikacin, capreomycin. Then they are further divided into 5 groups. Group 1, first line oral drugs: isoniazid, rifampicin, pyrazinamide, ethambutol. Group 2, injectable drugs: streptomycin, kanamycin, amikacin, capreomycin. Group 3, fluoroquinolones: ofloxacin, levofloxacin, moxifloxacin, ciprofloxacin. Group 4, second line oral drugs like ethionamide, prothionamide, cycloserine, para-aminosalicylic acid. Group 5, bedaquiline, clarithromycin, clofazimine, and linezolid. So the treatment regimen for a TB patient is divided into 2 phases: intensive phase and continuation phase. For a patient first time affected with TB, for those patients, the intensive phase is for 2 months and continuation phase is for 4 months. So total duration 6 months. So the patient receiving isoniazid, rifampicin, pyrazinamide, ethambutol for 2 months, and after completing their intensive phase, they receive isoniazid, rifampicin, ethambutol for 4 months. So total duration 6 months. If a patient previously treated, for those patients, intensive phase is totally 3 months. First 2 months, the patient receives isoniazid, rifampicin, pyrazinamide, ethambutol, and streptomycin. After completing the 2 months, further 1 month, the patient receives isoniazid, rifampicin, pyrazinamide, ethambutol. After completing their intensive phase, the patient receives isoniazid, rifampicin, ethambutol for 5 months in their continuation phase. So total duration 8 months. Weight based calculation for TB drugs: isoniazid daily doses 5 mg per kg, rifampicin 10 mg per kg, pyrazinamide 25 mg per kg, ethambutol 15 mg per kg, streptomycin 15 mg per kg. And there are fixed dose combination of drugs are available. So they are prescribed based upon the patient weight. Like if a patient is 25 to 39 kg, that patient receives 2 tablets of fixed dose combination of isoniazid, rifampicin, pyrazinamide, ethambutol in their intensive phase. The continuation phase also, the patient receives 2 tablets, but it won't contain pyrazinamide. It contains only isoniazid, rifampicin and ethambutol. If a patient weight is 40 to 54 kg, the patient receives 3 tablets. If a patient weight is 55 to 69 kg, the patient receives 4 tablets. If a patient weight is more than 70 kg, the patient receives 5 tablets. So in a fixed dose combination, isoniazid contains 75 mg, rifampicin contains 150 mg, pyrazinamide contains 400 mg and ethambutol has 275 mg. So we see individual drugs. Isoniazid. Isoniazid is a first line TB drugs. Whenever a patient receiving isoniazid, the patient prescribed pyridoxine 10 to 20 mg per day. Why pyridoxine is prescribed for a patient receiving isoniazid? Because isoniazid will interfere with the pyridoxine metabolism, and isoniazid causes peripheral neuritis. So pyridoxine supplement is required whenever a patient receiving isoniazid. For example, if a patient started ATT and the patient completed their intensive phase without receiving pyridoxine, and the patient started their continuation phase, that time you will find that the patient is not receiving pyridoxine in their intensive phase. So for those patients, you should prescribe pyridoxine 100 mg per day. And isoniazid resistant because of gene mutation, CAT G gene and INHA gene, which are get mutated, means there is a chance of isoniazid resistant. Then rifampicin. Rifampicin is a first line drug. So whenever a patient receiving rifampicin, you should counsel a patient properly. Like while taking this drug, the patient had a urine secretion in orange or red color. So you should counsel a patient properly. And rifampicin resistant because of mutated in the RPOB gene. And pyrazinamide. Among the all first line drug, pyrazinamide has hepatotoxicity. All drugs having hepatotoxicity, but pyrazinamide has a high chance of hepatotoxicity, and it will also cause hyperuricemia. Pyrazinamide resistant because of mutated in the PCNA gene. Then ethambutol. Ethambutol is a first line TB drugs. So whenever a patient receiving ethambutol, you should counsel a patient, like whenever you get difficult to find a difference between a red or green color or blurred vision, you should immediately contact an ophthalmologist. Or while a patient receiving ethambutol, the patient should contact ophthalmologist after 2 months. It will also cause retrobulbar neuritis. So whenever we start ATT for a patient, we should check their SGOT level, SGPT level, total bilirubins and uric acid level. Uric acid level is checked for a patient who are receiving pyrazinamide. Otherwise, no need to check uric acid level. So we should check their SGPT, SGOT and uric acid level after 1 week of starting TB drugs. If the values are normal, we have to check again after 1 month. Then If it is normal, we have to check after 2 months.